I want to ask you a very important question. What if there was a way to take your health into your own hands, to foresee into the future a detailed breakdown where you could actually determine decades in advance when it's the most crucial time to do so and identify before a diagnosis is even a thought if you may be genetically predispositioned to hereditary forms of cancer and medication sensitivity? Stay with me over the next few minutes, and I'm going to break down for you how this can actually be a reality for you today, right now. But before I get into all of the details, awareness matters, and it matters a lot, because when you know better, you do better. You make better choices. That allows you to be proactive about what is to come. So let me put it into perspective for you just a little bit. Have you ever checked the news in the morning to know in advance if it's going to rain? I know you have, but why did you do that? Well, it's simple. It doesn't need a lot of explanation, especially if you're a lady, right? You spend time on your hair, your makeup, you might wear glasses, the rain becomes a nuisance. You want to dress appropriately. Know if you need to bring an umbrella, because we don't want to get wet and we don't want to get sick. So by knowing better, we can make a better decision before we even leave. Now, cell phones, we all have one. You know that fear that sets in when you drop your cell phone, that moment right before you pick it up off the ground when your heart skips a beat a little bit and you turn it over to see, is it safe? Can I breathe a sigh? Or am I now the new owner of a shiny new paperweight? Think about if you were going to be traveling out of the house today. Would you make a different decision in the direction you would go? Or maybe not leave at all and just stay home today if you knew that you were going to be in a fender bender? Even if you were not going to get hurt, wouldn't you just want the reassurance of being able to predict in the future, identify an issue that may or may not happen, and then make a better choice, and then avoid the financial implications? I think so. Would you make different choices if you knew, let's just say 30 seconds in advance, you have a little magic ball and it only gives you 30-second glimpses of time, but it lets you know if something unpleasant is going to happen in your life? Would you take the advice or would you ignore it? I think we can all agree exactly what we would do. So why not do that for our health? Because we would be proactive to avoid a broken cell phone, to avoid our makeup and our hair getting messed up, to avoid a fender bender. Wouldn't you like to do it before you take a medication to know whether or not you're going to have an allergic reaction? I know that I would. See, having the extra edge and knowing what's to come, it puts you in a prime position to get a game plan in place. Doesn't matter what the scenario is. Now, while I cannot predict for you what's going to happen to your car, your phone, or any other material possessions you have, I want you to imagine for a second being able to have that heads up with your health. Because see, that I can help you with. I can tell you that we're in a very special time of medicine, one in which personalized medicine is taking precedent. A time in which you absolutely, right now, have the opportunity to know in advance, years in fact, prior to an actual diagnosis, prior to ever having a single symptom, giving you a real chance to take a stand, take control of your health, which is needed more now than ever. And according to the American Cancer Society, 50% of every person in this country has been affected by cancer. Either they have had a personal diagnosis or they've loved somebody who has. By sitting with one of our agents today, you can inevitably change the course of not just your life, but your family's lives as well. Now let's talk about the scary stuff for a moment, okay? Education is going to be huge. This is what leads to an early detection. Early detections is what increases your chance of survival. Because when the C word shows up, immediately everything changes in an instant. Because cancer, it don't play around. It's a monster. It's considered a catastrophic event. It's a financial tragedy, an emotional tragedy, and a health tragedy, all wrapped in one. And the rate of speed that you get somebody into treatment is quite literally the determining factor in the outcome. However, most people, they don't actually go to the doctor and find out until symptoms appear. They get the lump in their breast, the pain in their stomach, the spot on their skin, the foggy brain, the scratchy throat, the body aches that don't go away. Because these symptoms mean that it's progressed past the early stages, at which point you begin to see it spreading to other areas of the body, now making it more difficult and more expensive to treat. However, there is no reason in regards to hereditary cancers anymore that you need to wait until it's too late, because early detection is available and it's a possibility for you. Now, there's many factors that contribute to and lead to a diagnosis of cancer. However, the most prevalent cancers are caused by the mutation of just 2 genes, and the earliest of detection can be done with no needles. Just a simple cheek swab can give you the answers that you need to have a jump on a diagnosis years before a symptom ever shows up. So now I want to talk about those genes really quickly. We all have BRCA1 and BRCA2 genes. But what we do is we complete a DNA test with a swab inside of each cheek that helps you to identify if you have the signs of possible mutations of these genes within your body. Now, having the gene does not mean that 100% it's going to mutate and that you're going to be diagnosed one day. But what it does is it advises that there is a substantial chance that it may happen. And these cancers are aggressive. They require a fast diagnosis and immediate treatment. By receiving a positive result of a possible mutation of these genes, you will be able to have a wellness protocol set up with your doctor and a genetic counselor. Therefore, getting in front of the cancer, you and your doctor will be able to watch your health much closer. And this gives you the advantage of catching it at onset in its earliest of stages, increasing the chances of eliminating the cancer rapidly, more efficiently, and increasing your potential to beat it. This is the one test that you don't just do for you. It's not just for the person having it done. It has a big impact on not only close relatives, but parents, children, grandparents, grandchildren, siblings, because now they can be aware that the cancer that's running through their family is in a genetic form, and they can also then proceed to take proper measures. Why? Because remember, they cannot wait until they have symptoms, because then it's too late. If a child, whether it's an adolescent, small child, adult, but the child of a parent has had cancer, it is imperative that the parents also be checked if they carry the gene. While there's a 50-50 chance that it could have been an environmental cause, they will only know if they have the test done. If the cancer present in your family tree is imperative that you have this test done to know, did it come from a genetic cause? You see, there's so many different types of cancers, so many organizations out there advocating for cancers, because everybody is affected by cancer, directly, indirectly, but they're affected. You see, the numbers, they don't lie. By 2035, okay, that's really just right around the corner. We're talking 15 years away, 16 years away. Cancer cases are expected to hit 24 million, with 14.6 million of those cases being caught in the more advanced later stages. You see, early detection is our only way out. Early detection is the only thing that can change this. By you having this test done, you will be responsible for helping your family to get the answers that they need to have an edge in this awful disease. So that brings me to our next topic. When you go to the doctor or to the hospital, you're always asked about allergic reactions. The problem with that is that the only way that you know if you're allergic to something is by the medication already being put in your body, and then kind of playing Russian roulette and seeing, hey, do we react poorly to it or will it be great? I mean, what kind of science is that? That doesn't leave much room for error. You know, the medical profession has been treating people with a try this medication and see if it works mentality without knowing if prescription medications have a positive or a negative effect on the individuals themselves. However, our medication sensitivity testing is the cornerstone of personalized medicine. Never before have we had this much control over our health plan. Determining how well you metabolize medication raises the chances of a positive outcome, and it reduces substantially possible adverse drug-on-drug interactions moving forward. You see, personalized medicine conveys a blueprint on how your body's unique molecular characteristics and distinctions allow it to process medication. So by having this test done, your physician will have the data necessary to custom tailor a medication management protocol for you moving forward. If you've ever been in a situation where certain medicines just don't sit right with you, or maybe they just don't work for you at all, this is the test that would be key for you and your doctor to know which medicines to avoid and which to administer the next time so that you will have the greatest success. You see, currently in doctors' offices all over the world, patients are given medications that either don't work or have severe side effects. And then the patient has to return back to their doctor over and over again until they try and find one that is right for them. PGX testing, or pharmacogenetic testing, offers a very appealing alternative to that puzzle. Imagine a day when you can actually go into your doctor's office after you and I sat together and did a simple swab of your saliva, and your doctor changes his mind about a drug considered for you because your genetic test indicated that you would suffer a very severe reaction to that medication. Crisis averted, right? On the flip side, your doctor may now be able to look at the results of this non-invasive test and find that you would actually benefit greatly from a brand new drug that's not maybe as tested as others that are out in the market, because your actual test proves to them and shows them that it would work well for you and that there's little likelihood you would react poorly to it. Now, being proactive prevents problems before they arise. Today, you actually have the chance as a patient to decide to take preventative measures. All you have to do is ask for it. And then you would have one of our agents reach out to you for a consultation and help you decide if this test is right for you or not. Genetic cancer testing is the wave of the future. And with a simple process that I just shared, you can take the very simple test to learn about your potential risk of cancer in relation to your family's history of cancer. The future is now. You get to choose your next move, to test or not to test. I mean, isn't that really the only question left? So who should be tested? Well, first of all, somebody who has either a personal history of cancer or has a family history where at least 2 family members have been affected, have been diagnosed. Screenings lead to prevention. Early diagnosis improves outcomes, and 5 to 10% of all cancers right now have a hereditary aspect. Now, on the other side, people who are using multiple prescription drugs, you would definitely want to consider taking this test. Millions of Americans are taking too many prescription drugs. or taking the wrong prescription drugs. And adverse reactions, unfortunately, they're actually the fourth leading cause of death in our country right now. But a simple test can prevent all of that. Now, this life-saving test may be no cost to you depending on your insurance coverage. We do take most insurances, but the best way to find out would be to get in touch with us today. We are having the opportunity to help people every single day, every single week, every single month, in which they are having this life-saving test done at no cost as a benefit of their insurance policy. So join us today and fight against cancer and medication sensitivity testing. Reach out to one of our associates and see if it's right for you.